Yeah.
100%.
So Craig with Cannatrek on the podcast today. You're in Victoria?
Yeah, that's correct.
Yep. And but you actually have two different facilities. You have a facility up in Queensland, from my understanding, and then down in Victoria. Can you tell me a little bit more about, I guess, your operations and where you're located and what you're doing?
Yeah, absolutely. Look, essentially, head office is based down in Victoria, in St Kilda, and cultivation facility up in Queensland, about 40 minutes inland of Brisbane.
And the cultivation facility, I saw that you got approval for a cultivation facility down in Victoria. Can you talk a little bit about that and like what the plans are and where you're headed down there?
Yeah, absolutely. So the Shepparton facility has been in the pilot works for quite some time and is fully signed off and approved on a development level. So it's shovel ready, and the clock's really ticking now. I guess Queensland was a bit of a proof of concept, and the facility up there to get cultivation up and running. And in the longer term, will become an R&D facility. While Shepparton is really at the size that puts Cannatrek on a global map potentially in terms of cannabis cultivation. It's exciting.
And so, what kind of is that? A greenhouse mainly facility, mainly just cultivation, or do you have a manufacturing arm down there?
Yeah, for sure. It's an interesting one actually, because once you go to greenhouse, the actual people start delving into the definition of a greenhouse and what that looks like. But end of day, essentially, yep, it's greenhouse. So indoors using the sun. And there's definitely potential at that facility for manufacturing as well. And it's a constantly evolving space, as you'd appreciate. In Australia, an industry in its infancy, rapidly evolving, sometimes potentially devolving and moving sideways and all over the place. Look, it does pay to just stay nimble, and all the licenses are there, all the approvals are there, and then really move with the market and the potential within.
I'm glad you said that, because I feel the market it's a new emerging industry. It's coming out of the black market into a regulated market in some sense, into a medical market here. To stay nimble is probably tough, given the current market, and I think that's a good approach to it at the moment, because there's so many what ifs and how it could go. So I think that's a good word to describe if you're going to approach the market, to stay nimble and be able to adjust your business model.
Yeah, absolutely. And look, in end of day, I guess the ultimate goal is getting product to patients that need it. Or medication might be a better term there, but how that's done is where one needs to stay nimble.
Gotcha. And so I did read on your website, does that involve the digital health platform that you guys are developing or have raised money to develop?
Yeah, absolutely. Once again, as I said, the ultimate goal is getting product to patient, and how do we do that? Have to simplify the process here in Australia. And as we've seen with other clinics and suppliers, that quite often does involve digital health platforms, and it's anything to simplify that process or the perception of complexity around the process, and get medication to patients.
And so, what issues have you run into so far with that side of things? And how do you see yourselves simplifying that? Is that through that platform, or is it educating the doctors? Is it educating the patients? What things have you run into, and then how do you see getting around that?
Yeah, absolutely. So it's all at different levels, really. As far as the patients go, I'd say in Australia it's still a patient-driven market. So the inquiries that we receive from healthcare practitioners are often driven by the patient being in there talking to the doctor about the potential benefits of medicinal cannabis for whatever they're experiencing. So, without going too far into knowledge. It's the patients really driving this, and then you come up against those common barriers from new potential GPs, and that really is about one, education, and this as you say, it's come from the black or the green market, whatever you want to call it, and there's a big stigma still around medicinal cannabis. And to be honest, if I were to put myself in the shoes of the healthcare practitioner, the general practitioner, I'd probably have the same reaction that, I've been treating my patients with these conditions this way for the last 15, 20 years. And now all of a sudden this has just cropped up. It's getting a lot of media attention, but is there really any substance there? So, education is definitely one of those big barriers. And, currently Cannatrek uses a great third-party provider in Medijuana that provide, it's RACGP approved, CPD points. So it's, it's seen as real education, and it is real education for doctors on the basics of medicinal cannabis. So that's one of the offerings that we've all got to really put out there to get doctors in a place where they're comfortable to prescribe for patients. And I guess number two is really around the perceived complexity of the special access scheme and the portal, and common comment from GPs being that, look, I really don't need any more paperwork. And if I can just sit here and write a script for a product that I've been writing for 10 years, why would I not continue doing that? So once again, that's where those digital health platforms can come into, at least make that process look more friendly and guided, and just, pre-fill in the gaps, I guess.
So that descheduling, I guess that kind of leads into this descheduling into a level 3 or a S3 product. What is your, I guess, perception of that? And then how are you guys tackling that to get that to patients? Is that part of your business model, or where do you guys sit within that? Because I know there's a number of hurdles you have to get through to get it over the counter. Can you just outline your take on that whole side of things?
Yeah, absolutely. This, I guess, once going back to that core of, this is an industry in its infancy in Australia, and part of sitting back and watching that, and watching it on a global scale, is we're looking at CBD and gummy bears and coconut oils available on the shelves overseas, and then we move to this place of rescheduling to S3 OTC for CBD in Australia, and thanks to the media, I guess, all suppliers, pharmacists, doctors received a huge amount of phone calls in the following 7 days in particular around what that looked like, and when these products would be OTC, and do they have them in yet, and what's the process, how do I get them? And certainly behind the scenes, and I imagine a lot of people might appreciate this, it's a little more complex than that. And so what's it resulted in immediately? A lot of phone calls and a lot of meetings. Look, we all knew it was coming. There was plenty of warning from the TGA that it was potentially happening, and then it was really very likely to take place. But it is quite a lengthy and complex process. With the main hurdle being one around evidence, and the at the ultimate level, a phase 2 double-blind randomized controlled trial proving efficacy for a particular condition. And I guess a concern for a lot of suppliers, or something that is being considered, is the actual delivery platform that makes that product unique to the evidence it is yielded. Because end of day, 150 milligram per mil CBD in an MCT oil with CBD as the API is not necessarily any different from another 150 milligram per mil CBD oil with MCT oil as a carrier oil. So the ability to really pinpoint that data to the outcome. Pinpoint that product to the outcome in the clinical trial, and finding its unique spot behind the pharmacist counter.
how does one, and I don't know if you have an answer to this, how does one differentiate their CBD isolate, I'm assuming, their isolated CBD product from another isolated CBD product? I know if you were in more of a, a full spectrum type of thing, then you'd have all these other cannabinoids and profiles in there. But with a CBD isolate like that, how do you differentiate your product from another? And then proving, I'm assuming you have to go down into a specific ailment that helps with.
Yeah, absolutely. So, yeah, end of day, as I sort of intimated, it really, for me, I believe it comes down to the delivery technology. So we're talking, bioavailability. One of the common ones is a sort of nanomycel technology. So anything that, whilst the technology can be, I know this risk sounding sort of callous and, forgetting about a patient-centric approach, but, really end of day on a commercial level, that technology needs to be patented. So it can be put behind the shelf and it will be the only one available for a period of time for that condition. And, maybe perhaps speaking too openly here, but really in terms of the condition to target, it's it's a matter of being a condition that doesn't require clinical diagnosis, where CBD is efficacious, but the patient can really go into the pharmacy and argue their case for suffering whatever that condition or symptom may be, and the pharmacist being comfortable to say, well, yep, I'm happy to give you that CBD capsule.
Of course, linking all that knowledge together to be able to prescribe that to the patient that's in need of that for their particular whatever it might be.
Yeah, which once again is providing its hurdles because that sort of bioavailability.
Of course.
Accredited bioavailable delivery technology isn't necessarily that available globally either. It's another industry in its infancy. So suppliers in Australia trying to create the relationships to work with those companies to get the trials through, to access that market.
Very interesting. So currently, aside from that, I know that you've built in ways with large organizations like Chemist Warehouse, and developed those relationships with the pharmacists. But then you also have to develop that relationship with the doctor in its current state, and that has to be quite a challenge. And I've talked to people. I'm like, well, do you have to go all the way back to the educational system to educate doctors? I know some people are, in with nurses and things like that, trying to educate those types of groups. But it's got to be quite a challenge to change the way people change the way people perceive this product on a national scale, especially here in Australia.
Yeah, absolutely. And that is going to be a long-term battle and initiative. And, out of it, we've really seen the rise of the medicinal cannabis specialist clinic. And, that was quite fascinating for me joining Cannatrek 2.5 years ago to see these, the more entrepreneurial doctors seeing the opportunity, being interested enough in the medication, believing in the efficacy behind it, to set up the medicinal cannabis specialist clinics. And, I'm guessing at numbers here, but for a good period of time, that would have been 75 to 80% of scripts potentially in Australia coming from these clinics. And what I do think we see is that where these clinics have started in the actual regions, the suburbs in which they've started, for quite some time, doctors in that area, other GPs outside the clinic were, the patient would come in asking about medicinal cannabis and they'd refer them off to the clinic. And the phone calls Cannatrek's been receiving in the last 12 months are that, I've been referring my patients off the last 1.5 years, but surely I can do this, and it's a nice little feedback loop actually, because they've sent the patients off, the patients come back to their regular GP happy, it's worked for them, they can tolerate the minimal side effects, they can potentially start weaning off some of the medications they've been on for a few years. And in that, whilst that larger data set, the clinical data set, isn't available, it's, you know, n equals 1, the power of that patient coming back and saying, well, hey doc, it worked for me, thanks for referring me off. And, you know, seeing that spread out to those doctors.
And is that is this product that's being prescribed, does it start in Australia? I haven't seen it as much. Just recently, people starting to ask for certain strains. It's mostly been, you know, can you get flower? What percentage is it? You know, and also on the isolate or distillate side, can you get THC or can you get CBD? It hasn't been strain specific, but I'm just starting to see it come about. I mean, I'd say a year and a half ago, 2 years ago, I think somebody was doing a clinical or a trial on sleep and cannabis.
Mm-hmm.
And I was like, well, have they looked at the difference between the indicas and the sativas? And I just simple question on LinkedIn, and the answer was like, it's just not that advanced here yet. You know, they haven't really thought about that side of the industry, where in the US, you know, California's been in the medical market for, you know, over 20 plus years. And when I was in high school, they had dispensaries, and you had to go to a doctor and all this stuff. So I'm just wondering what your take of it. Do you think that strain specifics will start to come into it here shortly?
Yeah, I'm glad you brought this up. This is probably one of my favorite topics in medicinal cannabis. So particularly looking at flower, you know, so common formats are, you know, either tincture, the most common two in Australia, either tincture or flower, as in dried flower. Looking specifically at the dried flower market, and I guess backing this with the fact that I was a winemaker for 10 years and spent 10 years in that industry, where it's, you know, very much about variety, and within the variety, different cultivars of Pinot, etc. But yeah, the flower market at the moment it really does remind me so much of the wine industry, and certainly you know, some very active social media groups on whether it be Facebook or Reddit, where the patients are discussing the flower they've been prescribed and the different cultivars. And I think, you know, once again, most interestingly is quite often it's a discussion around aroma and flavor and general effect, and there might be a footnote on efficacy. But yeah, certainly that, yeah, it's a big part of the flower market. And talking to Cannatrek's international partners, you know, certainly in Canada at the moment, I'm told that, you know, it's all about the next strain. Similar in Israel, you know, this is where you know, cannabis is available for recreational use, but it's all about the next strain and the next to market and what's new and what can I try. And that's certainly a part of the flower market in Australia. And yeah, and I think we're in a privileged position where there are some very good doctors guiding that process with the patients. So I certainly know the patients are arriving at their consultation, stating what they would like to try, and they've read about this online. And yeah, the doctor's there to, I guess, guide the patient and ensure the best outcome on a health level as well.
Of course. And so I guess, do you think, well, I've heard a lot about this just because I'm in this side of things, the flower shortage that's recently happened in Australia. Have you run into that, and can you talk to that point a little bit?
Yeah, absolutely. You've gone from my favorite topic to my least favorite. No, Cannatrek certainly did run headlong into that issue and being part of the great flower shortage in Australia. And I'll state here that we'll go from famine to feast by the end of April. But look, it was really, there was one major factor in that flower shortage. Well, the high level major factor is that Australia is still really relying on imports for the bulk of flower and, well, the bulk of products available to market. And number two is that, there's a process that takes place to get medicinal cannabis products into Australia, and that involves an import permit on the Australian end and an export permit on the supplier end out of whichever country, and then obviously getting it into the country. And the big stumbling block, what threw everyone, was really the delays out of Health Canada in giving export permits. So Health Canada sort of quote a 30-day turnaround, and late last year that started stretching out, and really is up at around 80, 85 days at the moment, with no real communication to anyone, whether it be in Canada or Australia, as to what was happening in that process. So yeah, that was the major factor, just a lack of ability to get product into the country. And Cannatrek has some product in customs at the moment, and that sat in Canada for probably 6 weeks on pallets collecting dust, and just couldn't be moved until that export permit arrives. So I do believe that the Australian suppliers, the importers, really, we had the system sort of down pat, and everything was running smoothly, but didn't see that one coming, unfortunately.
And then I guess leading on from that, I know a lot of guys are trying to scale up. A lot of guys are coming on board that are starting to grow or set up large facilities. Even though there's let's say a temporary flower shortage, how do you see some of these guys that are going to get massive, let's say your facility and a number of others come on board and they all start growing? I saw this in Washington State when I was in Washington, and you saw 2,000 producer processors, and let's say 1,000, let's say there's 700 or 800 cultivators there, and they all come on board and they start to scale. Does that drive the price down? What do you foresee? How do you see that coming about in Australia and internationally? Because you're really playing this international game here, because you can import and export.
Yeah, absolutely. Well, end of day, scales of economy will always drive somewhat price. So in expansion, and obviously having a market for what you're producing, will drive price down. And competition will. I've heard quite a bit recently in Australia about the race to the bottom, and how much prices have come down, and that's purely based on competition. Whereas my personal experience is that prices from suppliers overseas are actually coming down, and Cannatrek has been better able to negotiate price and pass on those discounts to patient. I guess more back to your point on the Australian setting. Look, prepare for it, but within Australia itself, I guess we're not really yet seeing that 20, 30 cultivators come on board. I don't have the exact figures, but I believe there's only a handful of the licenses that have been given that have actually been used to a permit level and going into facilities at the moment. And I feel like the Australian owned companies and suppliers that were planning on doing their growing and manufacturing here, they're also in a period of adjustment, and finding out what works best for the business, and how can we start turning this around to make it profitable, because all these activities require a huge amount of capital, and with some pretty long lead times. So in that consolidation phase, then when you start talking global levels, I guess that conversation changes somewhat. And I guess I'll focus more on Cannatrek, and if it were to fully roll out the Shepparton facility to the full of its capacity, it'd certainly be on a cultivation level, a footprint that's competitive with global standards. And then it starts coming back to things like cost of cultivation and agriculture in Australia, which is, we know, there's no questioning it, it's higher than international. But also, brand Australia and Australian agriculture, Australian grown products also have a great reputation overseas. So, I think it is already being seen in countries like Canada that there'll be a diversification of the market, and there'll be low-end products, high-end products. And as I say, with Australian agricultural products, quite often they're entering those markets at the middle to higher end levels, and not competing at that basement sort of low quality, just shift volume price. But there'll always be space for high quality products in more sophisticated markets where strains do count, and actual quality of the material landing on the shelves counts as well.
Yeah, I think branding Australia product, just like most other Australian products, are branded as that high quality. And if you guys as an industry can do that as well, entering into that global scenario, I think it will be interesting how it gets rolled out. How do you see that, I guess, fitting in into the, I know that a number of players here, and I believe yourselves as well, export to the European market. What's the landscape like over there, and how do you guys fit in over there?
Yeah, absolutely. It's really, it's country to country dependent, and also depends on how advanced the cultivation facility is. So to take the example of Germany, there's certain requirements there around the GMP level and stability data. So for Cannatrek, still acquiring particularly the stability data. Those trials are in place at the moment, but potential is there in the future. Cannatrek has already exported to England and done so successfully. And yeah, I guess I'll address that. Sort of heard a bit of not for Cannatrek yet, but heard a bit of kickback from Australian patients about product being exported overseas whilst not supplying the Australian market. And there's two levels to that, and one is for long-term stability and growth, and to get investors in, so these companies like Cannatrek can actually become profitable in the long term and survive for the Australian market. Those international relationships need to be nurtured and fostered early on. And number two is quite often, at the moment, there's quite a bit of biomass coming out of Cannatrek's Queensland facility. Not the sort of volumes that would warrant release on an Australian level. Once again, we just run the risk of running out of stock. And that's, as we appreciate, that's a complex process for doctors and patients to navigate around in Australia. So whilst there's much more open pathways overseas where that change of cultivar and concentration level doesn't impact so much, the feeling in Cannatrek is that we're best exporting those batches overseas, getting the return, and trying to treat the Australian patients, doctors, and the overall system how it needs to be to ensure that long-term positive outcome.
And then on top of that, you touched just a second onto GMP standards. So I just wanted to dive into this a little bit because of possible changes that could come about domestically in relation to TGO 93, and the difference between, I guess, GMP product that's manufactured here and then possible changes for imported product. How do you see all that coming about? What's your perceived, where that's all headed?
Yeah, for sure. I'll start with my personal take on it, and this isn't a Cannatrek position, but my personal take on it is that there is already a system in place. There's mutual recognition agreements with Canada, for example, that their manufacturing standards are sufficient enough under their regulatory framework without being GMP to import those, or export from Canada and import into Australia. My personal feeling is that a lot of the GMP conversation has really been driven by Australian GMP cultivators, manufacturers that can see the opportunity in excluding the international market and the imports that are taking place and cornering the Australian market that way. And I don't believe the results of that will be a price advantage to patient at this stage. Particularly when we're talking tinctures. Currently Cannatrek can import at about half the cost, if not less, than we can manufacture in Australia. So, once again, market in its infancy, and something which we'll all as an industry work through. But overriding that, my personal opinion is it's a bit of a mountain out of a molehill, the GMP conversation. Where it's heading and where it will end, I don't know. That's up to the regulators to decide. As we know, the submissions have gone in, but I don't necessarily see the advantage for Australian patients at the end of it.
GMP domestically, and then you know the difference between EU GMP and GMP that's produced here?
Yeah, for sure. No, I'll be honest, I don't know the nuances of GMP. It appears that EU GMP is the gold standard. And, you know, there's Colombian GMP, and Israel has their own GMP for medicinal cannabis. So there's, like a lot of things when it comes to regulation, it's a pretty fractured, appears to be from the outside, once again, without being in compliance and looking deeply into it. Looks to be a bit of a fractured system, but I don't know exactly what those details are. I would suggest that anyone wanting GMP would be aspiring to EU GMP, because once again, it makes you a global player.
Yeah, that's what I've seen as well. I've seen, you know, all these guys, you know, they're either looking for EU GMP, and that seems to be the top bar, but right below it is Australian pharmaceutical grade GMP.
Yep.
And so and then you get all these like food grade GMP and stuff like this, and everybody's trying to decipher where all these countries sit on their GMP standards. And it's very it's funny to watch, because you're just never sure where each country sits, you know.
Yeah, absolutely. No, it's yeah, it's intriguing.
The other one is that creates a little bit of a rift within the industry is testing and analysis. Do you guys run into that as well? Is different testing methods and different regions testing their product?
Yeah, we haven't run into huge. Look, the TG093 and TG100 are pretty clear in the methods and analysis that needs to take place. So the only real hurdle, and it's not much of a hurdle to be honest, that Cannatrek's come up against is that all of our international suppliers have to conduct extra testing in order to be able to export to Australia within TG093 regulations. But look, you know, the incentives there to get the export through for whoever the international supplier is, and I think it's sometimes taken a month to find the right lab that can conduct the analysis with the right equipment to get the right result for a pesticide that they don't actually use in that country. But it can be overcome.
Yeah, I think it can be overcome. It just seems like it's just a tough one for people to navigate through, to try to find the right testing analysis, the different types that they have to go through, and as far as I wanted to revisit, do you think that descheduling? So back to descheduling a little bit. So we were on Schedule 3 CBD isolate. Do you think it will ever go descheduled here in Australia, or is it going to stay a purely medical system? Do you think it will ever move to a nutraceutical type of model or a recreational model?
Yeah, for sure. I'll start by saying that I don't think it's if, but when for recreational use in Australia. But the when is like incredibly grey and murky, and no one has any idea. But all I've seen is loosening of regulation on a global level. Quite often it's around CBD, but Thailand recently and Pakistan, and there's very few countries tightening regulations on medicinal cannabis at this stage. So that to me can only lead long term to a recreational outcome. Focusing more on CBD, for all intents and purposes, everything I've seen is that it is a wellness product, and it appears that Australia is making that as hard as possible to get to that end post. But once again, it will happen. But yeah, it's pretty tied into process at the moment.
Australia likes its rules, regulations, and processes. They don't like to they like to set all that up first, and then let the industry go by those rules that they've set up. In the U.S., we're kind of backwards. They let the industry kind of set it up on their own, and then make the rules based upon what the industry has set up. I feel like, and that's the way it's gone over there. But I guess it's meeting in the middle of those two worlds. But CBD, I definitely think, I mean, it's kind of a no-brainer product that that people should be allowed to use, nutraceutically at least,
Yep.
to help with whatever they feel like it can help with,
Yeah, and it's that, you do sit back at the end of the day, and whether it's on the Instagram feed, and gummy bears and coconut oils, and infused with CBD, and I look at the meetings I'm having in Australia around getting the evidence to get it OTC, and they're just such disparate conversations. But we need to work with what we have today with an eye to the future, and it comes back to that whole premise of remaining nimble, doesn't it? You got to 12 months ago, there was a lot of discussion around the SAS system and how hard, is it too burdensome on doctors? It's ridiculous. And my attitude, and once again, I think the attitude of Cannatrek has always been, well, we're fortunate enough to have a system that is getting these medications to patients. So let's work with it while we push toward a better future. But be fortunate for what we have as well at the moment.
I think that's a great aspect, a great outlook on how to tackle it. And being nimble, I think, within the industry have to, just because of the level of compliance that governments are going to put on this. It's just a new emerging thing. A lot of people are afraid of it. So yeah, I think that's a great attitude that your company and you have put towards it. That's all the questioning I had. If you want to add anything, feel free. If you want to, if you have anything that you need or you want to talk about that would further the brand, I'll leave it up to you for the next minute or two.
Yeah, for sure. Look, I don't think I need to get too specific about brand, etc. Happy to talk more to any of those topics, and it's it is just such a dynamic and interesting area to be in. And I often say to my colleagues and people who are working for other suppliers that I think if one day everything became normal and settled down, we would all sort of be bored. We've become somewhat addicted to this, never knowing what the next curveball is, whether it's permits out of Health Canada or some other issue that keeps arriving. It's such a fascinating industry to be a part of, and personally, I fell into it. It's not, I don't come from a background of great belief about cannabis or its therapeutic benefits. I fell into it on a business level and come from a science background, checked out some journal articles, and so like, wow, there's actually, there's something really here, and started to pursue it from there. So, sort of, I guess I understand the stigma side, and as you just said, there's still a bit of fear around it. And my partner's a criminal barrister, so she in her day-to-day work sees I guess the evil or detrimental side of abuse of cannabis, and what those outcomes can lead to in terms of mental health, and the way one human can treat another. And it's not all sitting here and saying, oh, it's an amazing medication, and it doesn't work for everyone. And like abuse of so many things, abuse of cannabis can lead to some really grim outcomes also. So we have some quite heated debates of an evening in the house over availability and how that should look.
And I agree. I totally agree with you. I think that if you overuse anything, if you overuse sugar,
Yep.
or you use over abuse, anything, it could be detrimental to you. So it needs to be in a regulated format. You can't just leave it up to the free market to let them do what they want. It needs to have analysis and testing specifications. The government needs to have a hand in there, but they just don't need to, in my opinion, they still need to let the market decide if they want to use it. You know,
Yeah, yeah.
that's my opinion on it. With any natural product, I think they should be able to use the product as long as it is regulated and it is monitored in some sense. That's my stance on it. And yeah, you shouldn't be able to abuse anything. I think there should be limits on certain foods and stuff too, but they don't do that as much. They kind of just let that go. But yeah, that's a tough one to solve as far as quantities that people can buy and things like that. In the U.S., I think there's still possession limits in certain areas. You can't buy too much at one time. You can't go buy a kilo of pot from a recreational store. You know what I mean? It's still individually bagged and priced and things like that.
Yeah, yeah, and there's those proof of concepts as well, isn't there? Canada's going to be a great example of, does the entire society go to poop because of recreational legislation, or does business continue as normal and things may get better, things may stay the same, do they get slightly worse? And we'll be able to look to those. I think the great the obvious parallel everyone looks to is alcohol, and there's some regulation around that in terms of driving, etc. But end of day, that's left up to the consumer, and people consume alcohol for different reasons. And as I say, I might have mentioned I was a winemaker for 10 years. I did, and my reason for consuming and enjoying is probably one of the more common reasons.
I think there's a lot of similarities. I saw it in the U.S., a lot of similarities between the wine industry and the cannabis industry. In the United States, it's still getting to that here, like you were saying, the strain specifics, certain manufacturers, certain cultivators, certain techniques that they're cultivating in, a whole host of things that are kind of also in the U.S. Microbreweries are a big emerging market over there, and they are here as well. But there's a lot of similarities in that side of things as well.
Yeah. No, we don't know what the future holds, but we've got an eye on many different aspects.
Yeah. Well, thank you for your time on the podcast. I'm going to cut that off.
Yep.
And appreciate you coming on. But I just did want to ask you if you have the time, just a couple more things aside from this podcast thing.
Yeah.
So I'll just end this recording. Stop recording.